Hello, Taneele Bruce. Thank you so much for joining me today on Conversations with Angela. It is a pleasure to have you here today.
Oh, thank you so much for reaching out, Miss Green, and just looping me right back in. I wish it were under better circumstances, but here we are.
Absolutely. And please call me Angela. So, you are a maternal and child health professional and doula. And
Yeah.
you are somebody that I think more and more Black women are going to be looking for in coming days. So, as we were discussing, before we came on live, the world is on fire, over these two stories that we've heard just
Yeah.
within days of each other about Black women being just totally mishandled when they've gone to the hospital and have presented in active labor.
Mhm.
So, from your perspective, what do you think? Why do you think, rather, that these incidences are happening?
Um, so I think these incidences are happening and have been happening, and if they aren't addressed properly, will continue to happen. Just due to racism. The answer is as simple as that, and we're up against a system that is deeply rooted in misguided and misconceived notions of Black people, Black women specifically, since that's who we're talking about in these particular two occurrences,
Mhm.
not experiencing or feeling pain on a scale that's comparable to our counterparts.
Yes.
There have been studies done where medical students, have shown a level of bias when it comes to their interactions with Black patients, and a certain percentage of students have been told or harbor these preconceived notions that Black patients don't feel pain, have thicker skin, are 9 times out of 10 drug seeking when they present to the ER. So it's these thoughts, it's these approaches that are unfortunately having a negative impact on the care that's being delivered to Black patients and Black maternal patients specifically. Um, it's like you said, the world's on fire in more ways than one,
Mhm.
and there are so many people, so many organizations, so many groups that are mobilizing and coming together and doing the important work of trying to improve maternal health outcomes for women, for men, for children, for families overall. And we're getting so much pushback, so much resistance, a persistence of these occurrences happening time after time after time again. Um, now I'm thankful that these two sisters in particular are still here with us to tell us their story, to tell us their experiences. I'm thankful that they're here. I'm thankful that their babies are here. Um, but you can't help but wonder, what if the situations continued to go left?
Exactly.
You know, what
Exactly.
what if these morbidities turned into mortalities, because morbidities are near misses. They're complications that occur during pregnancy, during labor and delivery, or shortly after giving birth. And
Yes.
so, these women most certainly experienced complications, and without without knowing the medical history of these two women in particular. Look, racism to me is a complication.
Oh,
Okay,
absolutely.
it's a
Absolutely.
complication.
A huge one. So, would you say that situations like these are reasons why more Black women should consider home births?
Absolutely, especially if and guidance that I have given to that I've given to clients, that I've given to families. If you are pregnant and your pregnancy is otherwise healthy, uncomplicated, everything is going smoothly, your numbers are coming back beautifully and normal and within range, there is absolutely nothing preventing you from seeking out alternatives with regard to giving birth. And this can look like a birthing center. This
Mhm,
can look like a home birth. Um, this can look like a hospital that is affiliated with a midwifery practice.
mhm,
So there are a number of options that are out there and available for individuals who have healthy and uncomplicated pregnancies. Now, for people who are considered to be high risk or may have some factors that may impact their pregnancy. For example, if you're hypertensive or newly diagnosed as having hypertension, if you have a history, so if this isn't your first pregnancy, if you have a history of maybe gestational diabetes, um, there are certain things that impact the delivery outcomes or the options that are available. um and I hate this term, but advanced maternal age, that
mhm.
that plays a role.
Yeah.
um and apparently, birthing while black
Yeah.
plays a role as well. so
Absolutely.
so we have so much that we have to bear in mind and that we have to be privy to when we're planning our birthing experience, when we're making the decision as far as where to give birth, who do we want on our birth team? Who do we want supporting us during this time? But to your point, yes, if you have a
Mhm,
pregnancy that is healthy and uncomplicated, and you have had a positive and a healthy experience with your primary care provider or whomever is delivering care, then it's not off the table at all to explore a birth center birth or a home birth.
that it wasn't that long ago that that was all the only choice that Black women had.
Exactly.
It was not that long ago, that
No,
that
it
was
wasn't.
all we had. We couldn't go to a hospital, so that was the only
Exactly.
choice that we had. And speaking of that, and midwives, give us some idea of what your background is like and what your typical day looks like when you're working with pregnant
Sure.
women.
Absolutely. So, I work with pregnant and postpartum women, children, and families in the city of Baltimore. And so, a typical day. So our main service is our home visiting program. So, as program manager, my typical day involves interaction with clients, mostly in the area of group education. So, our prenatal support group, our postpartum support group, breastfeeding education, and then also parenting classes. So, on any given day, I am either leading or co-leading those group education classes, and also just creating and developing and facilitating different programs and projects that directly benefit and impact the families that we serve in the city. We work with a number of community partners, also individuals in local and state government, and also hospitals and health systems, in addition to city and state health departments, in order to make to make these things happen for our families. So, as you know, in the nonprofit space, many of the individuals are Jacks and Jills of many different trades and wear
Right.
multiple hats on any given day. So, the day varies, from day to day, from week to week, but the focal point is delivering quality services that improve the quality of life for our women, our children, and our families.
So, what are the benefits of using a midwife as opposed to a hospital?
So, one thing I must say, I have to make the distinction between doulas and midwives because
Hmm.
some folks may think that they're the same thing and they're not.
Okay.
They work together, they work
Hmm.
beautifully together, but they
Hmm.
are different professions, different
Okay.
people, different skill set. A midwife is they've gone through the medical training to be able to deliver your baby. So
Okay.
if you choose to have a midwife on your birthing team as opposed to an obstetrician, you are well within that right to make that
Hmm.
decision, to have that individual providing your care. There are a lot of women who do not see a gynecologist. Instead, they will see a midwife or a nurse practitioner
Hmm.
to deliver their care. And then in the event of pregnancy, some women may opt out of receiving care from an obstetrician and will go with a midwife. A doula is a birthing assistant that provides emotional, physical, and informational support to a pregnant. Well, I actually shouldn't say that because there are a number of different doulas
Okay.
across the spectrum, but
Okay.
but they do provide various kinds of support to the birthing individual and their families. They, however, do not receive the same type of training as midwives, and they are not the ones that are delivering the baby. They're helping with the process. They are facilitating the process, but they are not
Okay.
the ones catching your baby.
Well, thank you so much for that education because I was one of those who thought they were the same. They work
Oh,
closely
no, no,
together,
no.
obviously, but they are different. So,
Different
thank you so
perceptions.
much for that education on that.
Different
So, what are
perceptions.
some of the initial concerns that pregnant moms should consider when they're thinking about doing a home delivery and they're going to use a midwife? What are some of the initial concerns that they should think about?
So, for anyone who is experiencing their first pregnancy, they're about to be a new mom. Some of the concerns really center on like just the unknown. They don't know what to expect. Everything is new to them. It's a whole new experience, a whole new process. They're probably working with a whole new group of people with regard to their birthing team. So a lot of things are unknown. A lot of things are kind of in the gray area. So it's really important for the individuals providing care and support to make sure that the birthing individual is well informed and able to make well informed decisions for themselves. If they have a doula on their birth team, that doula can step in and bridge the gap between them and the healthcare team with regard to providing advocacy for the birthing individual and their family. Um, as far as a home birth, some concerns may be that birth is unpredictable. So you may go into a home birth situation and everything is, daisies and gumdrops,
Mhm.
but then something can happen. There can be a shift that requires you to then make that transfer from a
Mhm.
home birth to perhaps a birthing center or escalate it up to a hospital, depending on the situation, depending on what's happening, and also what type of support is needed in that moment. So I would say that's probably the biggest concern,
Okay.
not really knowing what to expect, even with a pregnancy that's healthy and uncomplicated. Still having that, that margin, that possibility of something shifting and you then needing a different level of support.
Okay. So, how does one find a midwife or a birthing center, and does insurance typically cover that?
So usually the hunt for a midwife, a birthing center. So a lot of these, I mean, we're living in the digital age of Google. So a lot of these,
Mhm.
you just kind of
Google
punch
it. Hmm.
a search in and see,
Okay.
see what hits come up for you. However, if you are within a medical system, you can actually start to inquire with your primary care provider or with your gynecologist. Hey, is there a midwifery practice affiliated with within this system? um when you start to decide where you want to give birth, you may focus in on a hospital first, but you can ask, hey, is there a midwifery practice affiliated with this hospital, and
Okay.
if so, how do I get connected? um, but also, aside from a Google search, another wonderful search resource is System Midwife Productions. It is a searching tool that was developed by a Black woman. And when you key in your address or just where you're located in the
Mhm.
United States, it provides you with a listing, a directory of midwives, doulas, and other birth workers in your area that you can connect
Nice.
with.
Nice.
I think that's absolutely amazing. There are a lot of
I think
women.
so too.
I think it's great, and there are a lot of women that have found me through System Midwife Productions. And if you just type in systemmidwife.com, the directory comes right up, and you can just go ahead and utilize that particular tool on the website. So
Nice.
I think that that's an amazing way to find people that are just right there in your area. There are some other directories that are out there as well. Um, as far as doulas, you can utilize the National Black Doula Association. That's
Hmm.
another amazing resource
Hmm.
for individuals that are seeking doulas that are equipped to provide culturally congruent care and support.
Hmm.
So these are just some
Yeah.
things off the top of my head,
Yeah.
and if the birthing individual happens to be a Medicaid recipient, they can inquire within Medicaid with regard to the availability of doulas in their area, midwives in their area, because certain states now have doula Medicaid reimbursement. So
Nice.
if there's
Okay.
a program like that in place, they should be able to access doulas and other birth workers that are listed within their portal to provide services.
So I imagine that using a midwife and a doula who would be, I guess, assisting or part of that process is a lot cheaper than a hospital birth. You have any idea on what those numbers look like when you're comparing like a hospital birth to what someone might get if they're using someone at home or a birthing center?
So, so with regard to cost, so this part is relative
Hmm.
because everybody is coming from different socioeconomic backgrounds,
Hmm.
different financial situations. Um, so basically, if you have private insurance and you make the decision to utilize a doula, more often than not, that cost will be an out-of-pocket cost. However, through Medicaid, um, the support and services provided by a doula would be of no cost to you. So there's a difference there. Now, as far as as far as midwifery is concerned, again, if you opt to have a midwife provide you with care and service as opposed to um, an MD or a DO, then there really wouldn't be that much of a difference in cost. The cost would start to come into effect if you are pretty much if you're paying out of pocket.
Okay.
Um, if you're paying out of pocket for these individuals to provide you with support during your pregnancy, labor, and delivery. Um, so there are folks out there that are that are paying out of pocket for both midwives and doulas, especially if a home birth is something that they desire. However, if you utilize a midwife and a doula in a hospital setting, then the cost is going to be a lot less
Right.
versus a home birth. Birthing center. I'm not too sure as far as what pricing would look like in that respect, but a lot of things regarding price boils down to what type of insurance you have, what's covered, what isn't, and I see the biggest differences between folks that have private insurance and those who are Medicaid recipients.
Okay. Are there any risks that are associated with using a midwife that one would need to be aware of before they made that choice?
When I think of midwifery as a practice, I can't help but think of more benefits than risks, to be quite
Nice.
honest with you.
Do tell, do tell.
So, so the benefits are so a midwife is going to provide you with care and support that is more holistic in nature, and they're going to take a more tailored approach in delivering that care and support to you. It's not a one size fits all. It's not like an assembly line
Mhm.
culture that we see oftentimes when when we're in the doctor's office and we only have about 15 minutes, maybe 20 max, to have a face to face with the doctor, and if we're lucky, get all of our questions and concerns
Mhm.
answered and addressed. Midwives tend to take more time out with you.
Mhm.
They want to assess your pregnancy and your health in their totality.
Mhm.
So that way, if anything were to arise, they have a solid baseline to work off of because they have taken that time out with you at the onset. Um, so yeah, I mean, the only risk may be, that they're in higher demand now
Yeah.
with everything that's going
Hello.
on.
You have a hard time
And
getting
that's a
on the
good problem to
schedule.
have. That's a good problem to have. Now, I will say this though, with regard to just a quick stat here, and this is a little disheartening and something that needs to be improved upon. The percentage of the percentage of midwives that are currently in practice here in the United States who happen to be Black, less than 2%.
Get out.
So less than 2% of
Get
practicing
out.
midwives in the USA are Black.
That's
Or
almost as bad as we have of Black doctors, which is less than 5%.
exactly,
That is, that's
exactly.
not only is that bad, it's really shocking because, as I said earlier, that used to be the only way that Black women
Oh,
had a baby.
it used to be the norm.
Yeah,
Back
that is
in so
shocking.
from pretty much from slavery up to about the 50s, give or take, the majority of babies delivered in the United States and in the South particularly
Mhm.
were delivered in the hands of a Black midwife.
That
It was the
number is
norm.
startling. How
Yeah.
did that flip?
We have the Shepherd-Towner Act to thank for that, unfortunately, and this was put into effect due to basically individuals saying, "Hey, you need a license to do this. You need
Uh-huh.
credentials to do this.
Uh-huh. Uh-huh.
We can't rely on your mother wit. We
Mm-hmm.
we need you to have a piece of paper saying that you can do things.
Ah, okay.
So
Even
this
though it's been done in your family for generations,
even though this is like even though the folks that have been
monetizing it.
providing not new to this at
Yeah.
all, but
Uh-huh.
yes, we have capitalism and monetization to thank for this racism once again,
Oh, yeah.
because that's when we started to see the shift in the profession. We saw a lot more white nurses getting credentialed
Mm-hmm.
because the resources were in place. The system
Mm-hmm.
was being built to benefit them and
Of course.
to push black practitioners out.
Of course.
Their ways of practicing were looked at as barbaric and unclean,
Mhm.
and we know that they were anything but.
Exactly. I mean, look how many Black people were. My mother says that she can remember when my grandmother was pregnant with my aunt, that she said, I remember my mother telling me to get on my bike and go and get the midwife. She said that's
Yes,
how common it was, that, the midwife, you just call and go get the midwife and she
go
comes
get
to
the
deliver the
midwife.
baby. So she
Hmm.
said, and my mother's 83. So, in the grand scheme of things, that's not that long ago,
No,
that was happening, so that's startling to find out that it's what, 2% of
less
Black
than two
women?
percent. Less
Wow.
than 2%. And it's startling because the practice of midwifery extends beyond birth. Midwives were providing spiritual care and support to communities. They were providing support to individuals and families that were impacted by grief and loss. They were really providing that bridge and that go between community and any type of hardship that was being faced around that time. They were truly bridges and pillars within the community. So, go get the midwife. Yeah, get the midwife when you're about to give birth, but it just meant so many other things
Yeah.
back then. So the fact that we're looking at less than 2% now, it's more than a flip. It is a huge shift in the culture and in the practice.
Yeah, and I guess you don't really have to look that far to know exactly what happened. Like you said, when you see something like that and you see such a dramatic change in a field like that, that that almost all Black people were born with a midwife, like you said, from slavery, from the time that we were brought over here on a boat, and
Hmm.
now it's less than 2%. You know what happened. You can see
Exactly.
the handwriting on the wall. So I'm just going to take a stab at this and say that you probably don't have to worry about a midwife turning you away when you're in active labor. That's probably not going to happen.
I don't think we're going to hear any headlines that even remotely sound like that.
I hope not. I
I'm
mean,
I'm taking a real safe bet with
and
that.
I'm gonna take one with you. I don't think that that's gonna happen. But tell me, what were your thoughts when you heard about the first video, and then of course the second video,
Hmm.
which was probably worse than the first because you have to give birth in the car when you're sitting there like, okay, it's coming, it's coming. What
Absolutely.
were your thoughts and feelings as someone who works in this field? What did you think?
I mean, I was disgusted and I was horrified, if I'm going to be, completely honest. I watched the video of of the first sister that was in active labor, and just just the pain that was etched on her face, the pain, the agony, the fact that the nurse didn't even glance at her, didn't even look in her direction. the fact that she was just so cold and robotic
Mm-hmm.
and just dismissive of the fact that you have this woman screaming
Mm-hmm.
in pain, like this baby is coming, and you're worried about which pregnancy this is, first,
Mm-hmm.
second, third. You know, oh, I just need you to answer these questions. What?
Yeah.
And I keep thinking of so many different ways that that could have been handled,
Yes.
and still would have been, and still would have been, in compliance with protocol. I You know what? I see that you're in pain. Let's
Mm-hmm.
we can do this later. Let's get you to a room.
Yes.
Or listen, I'm wheeling you to a room. We're walking and talking.
Mm-hmm.
Okay.
Exactly.
I'm asking questions. You answer me in between contractions after you've had a chance to catch your breath. Um, because, and people are not aware of, the instance of precipitous birth, which is birth that happens very quickly.
Mm-hmm.
Um, this is birth that goes from 0 to 100 very fast. These are the births where you're seeing literally blood in the hallway because the baby is crowning while the mother is being
Oh,
wheeled to
wow.
the room. Babies are being delivered, en route,
Oh,
to the
wow.
room. So,
Wow.
who knows if that? I mean, she delivered her son 12 minutes after the fact.
I know, which
If
means
that
there was zero time to get her ready.
Zero time
Zero
to
prep
prep
time.
prep the room,
Mm-mm.
get her ready, have the doctor, scrub up and get
Mm-mm.
the protective equipment on, like
None of
12
that
minutes
happened.
after.
Mm-mm.
It's crazy. I mean, what if she had like asked her, one or two more questions? What if she, kind of dilly daddled for any number of minutes longer? And as far as the second instance, it's it's wild to me that you present to the hospital and clearly in active labor. Okay, this isn't an instance of, you know, I felt something and then,
Mm-hmm.
they check you and you're not even 1 centimeter dilated and they're
Right.
just like, all right,
Yeah.
do
Yeah.
you're otherwise okay. Do you want to stay? Because we can
Mm-hmm.
send you home. This was not that.
No.
This woman presented in active labor,
She did.
and in the nurse's mind, the solution was send her home. In what world does that make sense?
I don't know. You
In
can
what
tell
world
by
does
the
that
way
make
she
sense?
was breathing that something was happening. You could just
Something was
look at the way that she
happening.
was breathing. You knew that she was in pain.
And
Oh my gosh.
if you didn't know what was happening, right? In that moment, if the nurse didn't know what was happening, hey, let's at least get her in a room and get her looked at, right?
Or let a
Send her
doctor come and look
home.
at her. Something. None of those things happened according to
None of
her.
those things happen. Hey, you
Mm-mm.
can go home. You can
Mm-mm.
go home. We need to keep this room free. We need to keep this bed free. What?
Those
Why?
are just the two stories that we know of. Imagine how many others have happened that we don't, how many times that happens and we don't hear about it. We just heard about those two. That's probably happening
Mhm.
to somebody somewhere right now. They're being turned
Absolutely.
away.
The
I
fact that
know.
the fact that they happened, as we were chit chatting prior, the fact that they happened literally within days of each other, within the week,
Yes,
it's a very strong indicator that these occurrences are happening way, way more frequently than what's being reported.
absolutely. Absolutely. And I got a feeling that you're going to be real busy for the rest of this year and probably the coming year. If your phone hasn't already been ringing off the hook, it will be real, 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 real soon. Because I know that, if I were pregnant, I would be like, I need to do something different because I don't want this to happen to me. So I know just from reading the comments from those two stories that we were talking about, how
Mhm.
more and more people were saying, yeah, you need to get a midwife. You should consider, doing a home birth. More and more people were saying that in the comments. So if they're
Yeah,
saying that, then that's what they're thinking. And that's probably what's going to start happening, because nobody wants to go through that. That's traumatic. Having a
yeah,
birth, having a baby is already enough, the wear and tear and all that you go through and the emotional stuff and all that. And then you're going
absolutely.
to be abused in the process too. No, nobody wants to go through that.
And we can't seem to catch a break because, we're what, five or so years out from a global pandemic that impacted policies across hospitals across the US where women found themselves giving birth alone, um, where their support people, doulas included, were not permitted in the hospital because we were trying to stop the spread. And, you know, we're we went from that to staff just outright, and this isn't new, but because we're seeing this in the headlines, staff just outright dismissing our pain, dismissing our birthing experiences, uh, telling us to go home, telling us, hey, I just need to ask you a few more questions.
Yeah.
We can't, we just, the systems that exist just are not conducive to us getting the quality of care that certain situations demand.
And unfortunately, it seems like it's just getting worse all the way around in all areas. This is just one, but it seems like it's just getting worse. It's just getting worse for us, as a community. But I'm glad that pregnant women have you and have other women like you who do this type of work and that they can turn to, that they do have a choice, so that they don't have to experience that. And I'm very grateful that you were able to join me today and that we were able to have this conversation because it was very, very necessary. So thank you
Yes,
so much for
absolutely.
joining me today. I know you were just getting home from work. So I want to let you go so that you can go and do your thing. But I do want to really let you know how much I appreciate you taking the time to speak with me today, about this subject because it is really important. And I think it's just going
Absolutely.
to get even more important as the days go by.
Yeah, I hope so. I hope that people really start to see the necessity and feel the urgency for improved outcomes across the board because so much of maternal health, so much is preventable.
Yes.
So much is preventable. Um, I marvel at birth because so many things have to come together and work in concert and go right
Mhm.
in order for both mother and baby to come out on the other side healthy, safe, and whole.
Yeah.
So many things have to go right. And so knowing that we really have to be intentional and adamant about demanding more for our mothers, demanding more for our fathers, demanding more for our children.
Yes, absolutely. Well, thank God they have you. Thank God
I'm
they
a,
have
I'm a
you.
drop in the bucket, Angela. I'm a drop in the bucket. There are so many people out here, so many good and amazing people that realize that, yeah, this is hard work, but it's heart work. You
Yes.
know, there's so many people out here that are invested completely and totally in seeing Black women, Black men, Black children thriving,
Yes.
thriving in all experiences and all facets of life, through across the life course perspective. So I'm one person. There's so many people doing meaningful and necessary work.
Yes. Well, I hope that we can get more so that we can bring those percentages up, that we can get
Yeah.
more of us that are doing this so that we can feel comfortable doing this, with having a midwife or doing a home birth or going to a birthing center. Nothing makes you feel better than to see people who look like so that makes you feel even better about a situation. So hopefully we'll have more people that'll be joining the field along with you. So thank you so much, Taneele Bruce, again for joining me today. It has been a pleasure to speak with you. Thank you, thank you, thank you.
Oh, thank you, Angela. Thank you so much for having me, and thank you for just taking the time out.
Absolutely. Well, I hope that we don't have to talk about, I hope that nothing else happens that spurs us to have this conversation. Nothing bad like this has to happen. I hope maybe the next time we talk, we are talking about how there's been an increase in the number of people who have joined the
Yes.
field. That's what I hope that our next conversation is about.
Yes, our next conversation needs to be about good news.
Absolutely. I agree. Well, until that time, take care of yourself, and I will speak to you again someday in the future with some really good news.
Oh, thank you so much. And you take care as well.
All right. Bye bye.
Bye bye.